So welcome everyone to our webinar. We're so excited to have you all join us for tonight's webinar. It's part of our coalition effort to pass hundreds of local resolutions in support of Medicare for All. We won't rest until healthcare is a right in the United States of America. My name is Melinda St. Louis. I'm our Medicare for All campaign director at Public Citizen, and we've joined together with many powerful organizations in this Medicare for All local resolutions campaign. This is our fourth webinar that we've had in 8 weeks, and it's thrilling how just in a very short time continued to make amazing gains here in Washington and importantly in communities all over the country. We have a map that we'll be sharing again with you underway to pass these local resolutions at Medicare-for-all Resolutions.org, and it's continuing to grow. We have dozens of efforts and activists digging in all over the country. And today was a very thrilling day for Medicare for All in DC. The powerful Ways and Means Committee held a hearing featuring Medicare for All, which was the third hearing in Congress in a month on this issue. Just a few months ago, it was nearly unthinkable that we would be at this point, been able to get a hearing in Ways and Means and for it to be taken this seriously. And we were able to see that happen in real time today. Our champions, Representative Jayapal and Dingell, held a press conference, and they said in that press conference today that the momentum is because of the organizing that's happening all over the country. And that's what this local resolutions campaign is all about. We're building conversations at the local level with local government officials, community partners in red, blue, purple areas all over the country to demand guaranteed health care for all. We have a really amazing lineup tonight. And starting with Representative Khanna from California. So he stepped out of an important markup in order to join us. So I will introduce everyone else afterward. I want to pass it over to him. Let me introduce Representative Khanna. He represents California's Congressional District, and he's one of our great champions of Medicare for All in the House of Representatives. He's also sponsored the most progressive legislation to challenge skyrocketing prescription drug prices and a bill that would allow state single-payer policies as well. He's a member of the Budget Committee that held a hearing featuring Medicare for All on May 22nd, and he gave powerful testimony and refuted many of the lies and fear-mongering that was coming from opponents. So Representative Khanna, we'd love to hear your impressions about the momentum around Medicare for All in Congress right now, given these recent hearings, and how you think the local government resolutions can support those efforts. So thank you so much for joining.
Melinda, thank you. Thank you for having this call. Thank you to all the leaders across the country that have joined. Let me echo what Melinda said and what Pramila Jayapal and Debbie Dingell have said. The only reason that we are making progress on Medicare for All is because of the movement across this country, the movement in cities and states across this country. To bring change in an institution as hierarchical and as slow-moving as the United States Congress, you have to have popular support. You have to have a grassroots mobilization. And so the work you're doing is really extraordinary, and it's having an impact. We had a hearing in our Budget Committee. We've now had a hearing on Ways and Means. And by the way, when we started even this year in Congress, that was not something that was guaranteed. We really had to fight for that as a progressive caucus to get those hearings. And it's the first time in many, many years that Medicare for All has had a hearing, and certainly the first time ever that they've had a hearing on as robust a bill as Pramila has introduced. So what are points that I think are very important? I think obviously all of us on the call believe in the moral argument for healthcare, that it is a inalienable right that shouldn't be subject to the whims of the market, that there is something about the right to basic healthcare that is about basic dignity. And we have to continue to make that argument. But I also think it's so important for us to make the economic argument, and that is what I have been focused on. I had taught economics at Stanford before I got into Congress, and had worked in the Obama administration at the Commerce Department and written on economic competitiveness. And the points that I have made with the budget director, and that he frankly admitted, is that Medicare for All, first of all, will save most Americans a lot of money. And most American families are paying between $6,000 and $12,000 for health care. And if they have Medicare for All, they would save orders of magnitude of money, because their premiums, the fee would be minimal, and the out-of-pocket costs would be minimal, especially because there would be a progressive taxation on that fee. So what you're saying for most Americans, working class Americans, middle class Americans, they're going to have to pay a lot less. Second, we know that people's wages are going to go up. And again, the budget director admitted this. He said that the average cost that employers bear for healthcare was about $12,000 a year. In addition to the cost that the family is bearing, employers are paying $12,000. Well, guess what? That's why our wages, one of the main reasons our wages in this country have stagnated over the last 30 years. Most of the wage stagnation can be attributed to the rise in healthcare costs. Employers, instead of putting that money into giving workers raises, have been paying that money to insurance companies and justifying it, saying, well, we're just providing this benefit to the employee. This is like a salary. So if you had Medicare for All, you would actually have people save money, and you would have a rise in wages. Third point, you would have our companies be more competitive. This is the case if you ask many manufacturing or factors, or if you ask companies in my district in Silicon Valley, why do they offshore? Why do they set up shop in Canada or someplace else instead of the United States? One of the biggest reasons they will tell you is healthcare costs. It's one of the biggest challenges for startups. It is a huge burden on American business to support healthcare premiums as opposed to places that have far lower healthcare costs. We spend 19% of our GDP on healthcare. Compare that to China, which is 5%, or most other Western industrialized nations, under 10%. That puts us at a big disadvantage. It's why someone like me, a congressman from Silicon Valley, can be one of the earliest and strongest proponents for Medicare for All. Most businesses, unless you're the insurance companies or the pharmaceutical companies, understand that this would be actually good for keeping business in the United States and our competitiveness. The fourth point is, in a changing economy where most people are going to have multiple jobs, you want people not to be tied to their employer for their health care. You know, one of the disingenuous arguments that people make is, under Medicare for All, you're going to lose your insurance, private insurance. Well, most people lose their private insurance all the time. I mean, I've been fortunate never to be without health care insurance, but every time I've changed a job, I have to choose a new insurance company and have to go through that process again. So it's not like we have one insurance company for life. The point is that it is very hard for people to change jobs if their health care is tied to their employer. And that is very bad in an economy that requires people to have more than one job. So those are some of the arguments that many economists make. And one of the things I often point out when people say, well, you're just going to have big government medicine or socialized medicine, is if you look at Taiwan, that has a single payer system. Taiwan, according to the Heritage Foundation, one of the most conservative think tanks in the entire Washington ecosystem, Heritage is number 10 in quote unquote economic freedom, higher than the United States. It means they have even a more free market system than the United States. And yet they provide single payer healthcare to all their citizens, and they transitioned from a market-based healthcare system to a single payer healthcare system, and it's been extraordinarily successful, and it means that their citizens have better healthcare at lower costs. The other thing I point out is Donald Trump, believe it or not, in his book in 2000, you can look it up, The America We Deserve, says that the Canadian healthcare system is better than our free market system, and that single payer healthcare provides better benefits at lower costs. So even he, before he became a political candidate, understood the economic benefits of Medicare for All. And I think we need to just keep getting that argument out there. The final point, because I took on John Delaney on Twitter, he was, saying, oh, Medicare means you're going to lose all your insurance and doctors and be without choice. There are a couple of things to point out. First, most Americans want to keep their doctor. They're not that wedded to their particular insurance company. Second, Pramila's bill and Bernie Sanders' bill and every Medicare for all bill allow private insurance. If you want supplemental insurance after you get Medicare for all, you can do it. Nothing will ban you. But what we're going to give you is probably going to be better than anything you can want to buy. But if we're going to give you vision and dental and comprehensive care, and if you still think that that's not good enough and you want to buy more, you can. So who wouldn't be for that? Who wouldn't be for the government providing better, free, relatively free, I mean, you have to pay a small fee, care to coverage to every American? And then they have the choice to go buy more if they really want to. It would be a waste, but they have that choice. So when these people are saying it's going to take away your doctor or take away your choice, they're just being disingenuous. And frankly, many of them haven't even read Bernie or Pramila's bill that has been crafted with great care and with a lot of experts. And I think it's so important that we push back. Let me just end by saying every win that you have locally is something that we can point to in Congress. It helps us make the case that it's time for the federal government to act. When a city does it, when a state does it, when you mobilize and speak out about it, this is going to be a very heavy lift, because despite the morality of it, despite the economics of it, people say, well, why hasn't it been done? Because Aetna's CEO doesn't want to give up his $59 million, because pharmaceuticals don't want to give up their extraordinary profit, because hospital CEOs still want to make $6 to $10 million. There are very, very powerful interests that have a lot of vested stake in the system. And that's what we're up against. This is not an intellectual argument as much as it's a political fight. And I believe that the only way we win that political fight is with leaders like yourselves at the grassroots level, pushing for change, making the arguments, and helping us convince the majority of the American people that this has to be the highest priority, both from a moral perspective and, frankly, to unleash our economic potential.
Thank you so much, Representative Khanna. We're so grateful for your leadership, and thank you so much for taking time out of your busy schedule to join us. And this is what it's all about. We're here to support all of the work of our champions in Congress, and thank you so much for joining us.
Well, thank you. Thank you to the champions. You can get me at row@rowkhanna.com, or tweet at me, or share any thoughts. And please stop by if you're in DC. And Pramila and I and Debbie and others would love to see you. But I just wanted to get on this call because I want to thank you, Melinda, thank Public Citizen, and thank all of the leaders across the country. What you're doing is noticed by all of us.
Thank you. Thank you so much.
Thank you.
So now I'm excited to invite the rest of we have an all-star lineup in addition to Representative Khanna, if you can believe that, for our webinar. We are going to be joined by Councilmember Stephen Cornell, who led last week's victorious St. Petersburg, Florida Medicare-for-all Resolution. We have medical students, reproductive justice, faith leaders in our coalitions, and organizers from California, Chicago, Maryland, and Florida, who are going to be sharing as well. And so I want to get started and invite and introduce each of them as well. And I just want to remind folks that you can chat, put your questions in the chat, and our panelists can go ahead and answer them. Feel free, panelists, to answer them along the way. And we hopefully will have some time at the end as well. But and for those who have called in, you can always email us questions, and we want to make sure all of those are answered as well. So I want to invite Keenan McGonigal, who is the Education and Advocacy Fellow for the American Medical Students Association, and important partners of ours, who was actually at the hearing today. I was there as well, and some of the others, to give us a quick report out from the Ways and Means hearing, because I know some of our most active folks would like to know that. And I also want to let folks know that we welcome those who are just getting started as well. And we hope that we want to have a mix on these webinars of introductions and being able to dig in. So let me turn it over to Keenan for a couple of minutes to give us a quick report.
Thanks so much, Melinda. Yeah, we had a very exciting day on the Hill. I think you did a great job of expressing what some of what happened. It was an amazing time. It was, you know, we couldn't believe that the Ways and Means, one of the most powerful committees in Congress, was holding the third hearing on Medicare for All in less than 30 days. But here we are. So amazing momentum. Definitely an important step into moving Medicare for All into the realm of the possible and implementable, and just opening that dialogue with folks on the Hill. We had an amazing time with, we did rallies beforehand with Public Citizen, Our Revolution, PNHP was there, AMSA, the Center for Popular Democracy, folks from Maryland were around. In the hallway outside of the hearing room was completely packed, couldn't move, line down the whole length of the building. And then afterwards, we had a great press conference with Representative Jayapal, Representative Dingle, Ilhan Omar was there. Other supporters came by. They had to run because of the vote, but we had a great time. Maybe you can tell I'm a little sun-kissed as a result. And the hearing itself was incredibly moving. So Rebecca Wood, a passionate activist, originally from Virginia, now in Boston, now in Massachusetts, talked about her heart-wrenching story with her daughter having to make choices between her own health care, her daughter's health care, and just an amazing story. Demonstrated the need for Medicare for All from just a powerful personal story. And then amazingly, Don Berwick, who some of you may know, former CMS Center for Medicaid and Medicare Services administrator, came out swinging in favor of Medicare for All. And this was an amazing move because he's a really respected voice on the Hill in the think tank circles. He's now at the Institute for Healthcare Improvement. And he is going to give a lot of credibility to our fight for sure. And then we heard a lot from our champions. Representative Lloyd Doggett from Texas, he had a great line about how he's tired of hearing criticisms of Medicare, Medicaid. They're ultimately just trying to, Republicans are trying to get Medicare for none. And then John Lewis said he's going to fight till his last breath for Medicare for All, for healthcare as a human right. And he actually introduced a statement from the NAACP in support of HR 1384. A bunch of other champions gave amazing testimony during the hearing. And then, of course, we heard the classic lines from Republicans who are really trying to harp on how Medicare is going to be unrecognizable if we get Medicare for All. And actually, one of their witnesses said, yes, it will be, one of the Republican witnesses said, yeah, Medicare will be different. It will have no premiums, copays, or deductibles, which she kind of played into our hands there. But overall, an amazing day, amazing to be there on the Hill with folks, and really powerful stuff.
Thanks, Ken.
Thank you.
And AMSA, American Medical Students Association, is a really important partner, and having future doctors in this fight is just an incredible boost to all of us. Now I want to turn it over to moving from the national to people around the country. There was very exciting last Thursday. St. Petersburg, Florida became the first city in Florida to pass a resolution in support of Medicare for All as a direct result of this campaign. And we're lucky to get to hear from Council Member Stephen Cornell, who is the local official who championed this resolution, and from Mike Fox from the Progressive Democrats of America, who did a lot of the outside organizing to win. So we'd love to hear from both of you to share some about this, how you did it, and the importance of this resolution. So welcome.
Good evening. Mike, you want me first or you?
Go ahead, Councilman.
Okay, well, it was a pleasure to support this. I just want to tell you, I'm also a school social worker as well as an elected official. And it was a complete, heartfelt, deeply recognized need that compelled me when Mike called to say, yes, of course, I'll do that. I'll bring it forward. A few lessons learned. Several of we went in because we have very restrictive laws that govern how we can talk to each other. We can't, basically, council members can't talk to each other about something coming for a vote. So I didn't know how it was going to go. My colleagues, ended up being 6-2. but I didn't know that it might die 4-4. So one of my colleagues said nothing, voted yes, and then on Facebook posted about her mom and how and all the issues she went through without having health care. And what that reminded me of some of the work that I did previously on gay rights, where we'd go in to talk to legislatures or city councils or school boards. And some of the most conservative people sometimes would end up being the biggest supporters. And as you got to know them, you'd find out they had a brother, an uncle, a sister, a son, daughter that happened to be LGBTQ. And so we got a lot of surprises. And what I think will happen as you continue to do this work, you may be surprised at some of the people that come forward because you put it out there. And so I think you should keep doing it. I'm on board. I'm ready to help in any way I can. Other elected officials. And I'm proud that my city is the first one in the whole state of Florida to support it. I've had a little bit of blowback, but my answer was, then what's your solution? Not liking this is not enough. You have to have a solution because these people are suffering, and I'm not going to stand by while that happens, especially when I have to sit across a desk from little children and families who don't have health insurance as part of my job. I'm just not going to be quiet about that. So I'm unapologetically supportive. I'm excited about it. I'm happy to help you any way I can. And thank you for what you're doing. And I do want to say, although I was the political person who brought it forward, the grassroots organizing of Mike Fox and dozens of people is what really made this happen. Not me. It was Mike and all the grassroots effort. And a big special thanks to all of them.
Thank you, Councilman. Mike, do you want to say a few words about the organizing?
Would absolutely love to. Number one, thank you so much for holding this webinar. We've got rock stars here, and I'm so excited to be involved with all. We at PDA have been in this fight since 2004 when we got started, and I've never felt this good about the process. There is no question we're on a roll here. I'm very excited to move from St. Petersburg into Tampa. I'm quite confident we're going to be able to pull something off there and go all the way across the state of Florida with this. And just a brief thank you to the coalition groups who piled on in this endeavor. Not only Public Citizen, but likewise NNU was there in a very big way. To anyone doing healthcare advocacy, if you're going to go into that war, bring a nurse with you. There is no question. They absolutely knocked it out of the park. And we had two different nurses who testified, brought tears. It was a beautiful thing. And I think that this example is a wonderful example of how coalition work definitely can nail this. If you're brand new at this, there will be help, no worries. Just find that good, solid, progressive council person that you have, and like Councilman Cornell, present them with what you've got, and then the troops will come in behind you to help apply loving pressure on the other folks who need to vote, and we'll just get it passed like we did in St. Petersburg. I'm psyched that we're not only the first in Florida, but likewise the first in the Deep South, and I'm looking forward to many more successes coming here.
Thank you so much, Mike. It's very inspiring, and thank you so much to Councilman Cornell for your leadership. And I know this is the tip of the iceberg, and we have dozens more coming down the pike. I'm convinced. So thank you. Next, I'd like to invite Elisa Kang, who is an organizer with National Nurses United, who in the Bay Area, to share some of the tips in the story of the successful local resolutions that were passed in Oakland and in San Francisco. So I welcome you, Elisa.
Thank you so much, Melinda. I'm truly honored and excited to be in the company of the other guest speakers and all the amazing Medicare-for-all supporters who have joined the call tonight. As Melinda mentioned, my name is Elisa Kang, and I'm a community organizer with National Nurses United and the Nurses Medicare-for-all campaign. I work out of our Oakland, California headquarters, so of course have to give a shout out to the Warriors. Go Warriors, Dub Nation. I will speak briefly about our successful efforts to pass resolutions in San Francisco and Oakland. In San Francisco, NNU worked in tandem with the San Francisco Bernicrats, a great ally locally in our fight for Medicare for All, to reach out to the Board of Supervisors about passing a resolution. Supervisor Sandra Lee Fewer introduced the resolution on March 12th, and not surprising to us because of the board's past support around healthcare and patient care issues, the resolution was co-sponsored by the entire board. A week later, on March 19th, Supervisor Fewer hosted a rally and press conference with Supervisor Gordon Marr, NNU, the SF Bernicrats, Jobs with Justice, Single Payer Now, and many other supporters in front of City Hall to continue to build momentum for the Medicare for All movement. We announced that the city and county of San Francisco will vote that evening on a resolution affirming the city's position that healthcare is a human right, that HR 1384 will address the healthcare needs of the people of San Francisco, and that the city and county of San Francisco urge Speaker Pelosi to support HR 1384. Nancy Pelosi, of course, is the congressional rep for San Francisco and is a key legislator that many Bay Area folks have been focusing a lot of organizing energy and pressure on because, as you know, she's a Speaker of the House, and the Speaker sets the legislative agenda for the Democrats and carries a lot of influence to either block or help move the Medicare for All bill forward. So after the rally and press conference, the resolution was voted on later that evening and passed with unanimous support. In Oakland, NNU worked with City Council President Rebecca Kaplan's office to pass the resolution. Council President Kaplan introduced the resolution on March 21st, and we worked together to secure the support and votes from other council members. In the letter to her colleagues asking for their support, President Kaplan stated that one of the reasons that Oakland City Council should support HR 1384 and Medicare for All was that the inability to pay medical bills continues to be a leading cause of personal bankruptcy, and people who need medical care should never have to face financial ruin as a result of needing health care, a sentiment we completely agree with. So on April 16th, the resolution was passed unanimously as part of the consent calendar, and pretty much all that was needed to be done at the meeting on that day was for us to show up and speak during public comment to thank the council on behalf of NNU. So there wasn't a lot of effort required to get this passed, but this was still significant because it helps us solidify the regional support for Medicare for All, and other city councils currently in the Bay Area are now working with the nurses and other Medicare for All supporters to pass resolutions. So just a few points I'd like to highlight before I end. NNU was able to build upon our longstanding relationships with members of both the San Francisco Board of Supervisors and Oakland City Council. So we knew who to approach and who we could rely on to carry the resolutions. So if you have existing connections, that is always helpful. But if you don't, that's okay. That's something that you can easily initiate. This relationship building, though, is really important for long-term organizing around healthcare and other issues that are important to your community. Also, the nurses have been working in coalition with many organizations around single payer, Medicare for All, fighting hospital closures and other issues, building a broad base of support that represents diverse constituency groups such as labor, racial, and environmental justice groups. The faith community is key, especially in cities and towns where you may not already have a majority of support amongst your local government officials to start with. And of course, showing that wide range of supporters and allies at the meetings and other actions related to passing the resolution is important. Lastly, a city council or board of supervisors passing a resolution unanimously makes a big difference and demonstrates a public mandate that your city, county, or town supports Medicare for All. So lining up this support before the actual introduction and before the vote happens is crucial if possible, and may require meetings with most or all of your legislators. A strong majority of support, of course, is amazing, but if you are able to win and secure 100% unanimous support, even better. And having multiple co-sponsors when the resolution is introduced can also make a big difference. So thank you everyone for all your great work. The nurses are so excited and thrilled to be organizing with all of you in this national campaign to transform our broken, profit-driven healthcare system into one that affirms that comprehensive, high-quality therapeutic care is a guaranteed right for everyone because healthcare is and should be a human right. Thank you so much.
Thank you, Elisa. It's a inspiring story, and we are so grateful to be partnering with NNU all over the country, and nurses and in general on this campaign. Now I'd like to turn it over to Sheila Garland, who also organizes with National Nurses United in the Midwest. We're moving from the West Coast to the Midwest now to talk about some really exciting work happening in Cook County and a recent protest at the American Medical Association as well. So welcome, Sheila.
Oh, thank you very much, Melinda. Hello to everybody who took the time to get on this call. I'm looking at like over 120 people on this call. This is phenomenal. So I'm very honored to speak at this space. It's also rather fortuitous that this call is taking place tonight and I'm on here to really highlight the real, crying need for Medicare for all at this period in time. We represent nurses at a small safety net hospital on the south side of Chicago, Jackson Park Hospital, that is about to close their women's services for a community that is horribly impacted, that has the highest rates of infant mortality and Black maternal deaths. And one of the things that's very clear to me, not only as a Black woman, but as someone who's political, is that Medicare for all will begin to even the fractured delivery of healthcare in this country, where hospitals and healthcare providers can select who will live and who will die. And so I'm very, very happy to be here on this call and to be in this fight, not only because it's important, but because I'm pissed that this still happened in 2019 and that the lives of so many people hang in the balance. So I do want to say that it was extraordinarily uplifting to be at the AMA Flyaway rally last Saturday. The coalition of organizations involved with that, the Jane Addams Senior Caucus, Progressive Democrats, Public Citizen. I mean, there's so many to name that really participated in this amazing event. We had over 500 people to come out and confront the American Medical Association for their absolutely egregious historical stand in opposition to Medicare for all, driven by, their corporate greed. There was a doctor who came out who asked if he could speak at the rally. And I said to him, well, if your intention is to say that you are coming out here to that we want to mend our horrible ways, and I'm coming out here to tell you how much we support Medicare for all, I said, by all means, I'll make space for you to speak. But if you say anything other than that, hell no. So he was trying to equivocate, and I said, no can do, no can do. So, but it was a great event. And so let me talk about what's happening. So just a little background. Cook County is I believe it's the second largest public health care system, the second largest county system in the country. It's huge, it's enormous, has an enormous budget, and they're responsible for the public health that gets delivered. They take on about 70% of all the charity care. And so it's a monstrosity that is, going through tremendous changes, as one can imagine, with the privatization of the delivery of Medicaid in the state of Illinois, like what's happening around the country in so many other places. And so that means that they are now able to deny coverage to people who are on Medicaid because of the privatization of Medicaid. But nevertheless, we participated with our partners in the People's Lobby through our Reclaim, and we elected a number of people to that Cook County board. So the attitudes of many of the people on that board have changed. They're a little afraid of us, which is good. It's always to have your enemies a little afraid. But also, I think they're also in awe of what we've been able to accomplish. And so one of those that we helped to elect, we approached and said, listen, we want you to introduce the resolution for Medicare for all. And he said, absolutely, I'm absolutely delighted. We thought we were going to get it through on June the 6th, but as it turns out, it needed to go through the Healthcare Committee, and the commissioner wanted it to do that so that they could have some deeper discussions in the committee about it. But it will go to the committee for discussion on June 26th, and on June 27th at their 10 a.m. commission board meeting, it will go for a vote. We only need 9 commissioners to pass it. After we had given our comments at the June 6th meeting, we had 3 more commissioners who said that they wanted to support. So we clearly have the 9 that we need to pass it. We expect it to pass on June 27th, and most likely we'll be having some sort of a press event to really amplify, talk about what we did. So I think it will help the organizing that we're doing around the state and of course around the country. I think that's about it, unless people have questions.
That's fantastic. Thank you so much, Sheila. And we will be sharing again the map of activities, and we'll be adding that and to our map. And so people can sign up to actually help testify in Cook County if you're in that area, and we will be replicating this all over the country. And so it's really inspiring, and thank you so much for joining us. And has Ellie been able to join us yet? I don't think I see him yet. So let me then turn it around, turn it over to a really important partner in the Medicare-for-all Resolutions Coalition, Ultraviolet. Susan Hildebrand works for Ultraviolet, and given the attack that we're seeing around the country on reproductive rights, we think it's really important to connect these struggles of reproductive rights and Medicare for All. So I wanted to have Susan talk to us a little bit about their work and how we can create those linkages as we're doing our local organizing for local resolutions. Welcome, Susan.
Awesome, thank you so much. Also, since I'm in Chicago, it was really great to hear some more updates about Cook County that sometimes, working at the national level, I don't know all the things. So thank you so much. I feel much more involved. And obviously, thank you to every single person who is spending, precious time being on this phone call, and even more precious time working to make sure everybody has access to healthcare regardless of their income, their immigration status, their geography. So yeah, I'm Susan. I'm the National Field Director at Ultraviolet. We're a national women's rights organization. And I do want to talk just a little bit about reproductive rights, and in particular, abortion access and Medicare for all. So we're in agreement, I hope, that abortion is healthcare. It's a really basic thing to say, but I think it's important that we practice saying those words over and over, because our opposition has been waging a campaign for decades to try to convince the public that abortion is a lot of things that it's not. And to be frank, they're not actually winning with the public, right? 7 out of 10 Americans believe that abortion should be safe and legal, but it's undeniable that the extreme right has had quite a bit of success against public opinion on the issue of abortion, and in a lot of ways has driven the narrative. So about 1 in 4 people with a uterus in this country, so that's cisgender women, trans folks, gender nonconforming people, non-binary people with uteruses, will have an abortion before they're 45. It used to be 1 in 3, and it's a bit fewer now because more people have access to birth control, and so that's not a bad thing, right? But abortion is incredibly common. Our right to safe abortion is in serious jeopardy, and that is most especially true and always has been for people who are living in poverty, for women of color, especially Black and Native women, for queer and trans people, and for young people. Most recently, we know about the bans happening in Missouri and Georgia and Alabama, but more than 400 anti-abortion measures have been passed in states since 2011. Some went into law, some didn't, right? Some went through the court system and were never implemented. But nonetheless, even then getting passed is not just damaging for the fact that it means we have a lot of people in office who don't care about abortion rights, but it also confuses people. And when we pass abortion bans, it's going to lead people to wonder if they're actually able to get safe abortion and potentially lead them to less safe avenues. 30 bans on abortion have been introduced, passed, or signed into law this year. And there are just so many attempts to obstruct access, like waiting periods, unnecessary restrictions for abortion providers, laws to require healthcare providers to lie to patients or perform invasive and unnecessary exams or procedures before an abortion. those are all the things that aren't just like literal abortion bans. And then those are being passed too. So no one should die because they can't afford a medical bill. Everyone deserves access to comprehensive, culturally competent care without going into debt. Abortion access saves lives. It protects families. It truly does. Without access to affordable abortion care, people turn to dangerous ways of attempting to end a pregnancy, or people have to travel out of state and get childcare and miss work and go through all of these economic burdens that are totally unnecessary. And 60% of people who have abortions are already parents, which I think is a statistic that not everybody knows. It's not always the image of somebody that we're thinking of when we talk about abortion access. Abortion care is not free or affordable for most people. There are 15 states that allow state Medicaid funds to cover abortion care. Illinois became one of them, just went into effect just this year. And that is really great. But even then, private insurance often doesn't cover abortion care. So there are people not eligible for Medicaid who just can't afford what could be potentially thousands of dollars for what might be a later or a more complicated procedure. So some states are doing the right thing. Some states are doing great work passing pro-abortion access measures. Illinois just passed the reproductive health access, just signed today. So states like Nevada, Illinois, New York, Vermont, some of those are about allowing Medicaid funding for abortion. Others are to make sure that abortion will be protected in their state if Roe v. Wade is overturned. But the fact is that this piecemeal, depends on your zip code situation, and we need a federal policy to ensure that everyone has access to abortion care, no matter where you live, no matter your income.
Hi, it's Ellie.
Oh,
it's Ellie
and somebody
Gomez.
just coming up on the call too, which is great.
How are you?
I'm good.
Sorry
I'm good.
I'm
I'm
late.
just gonna. Oh, no problem. I'm just gonna finish up chatting about Medicare for all
Ellie, we'll get to you in a
and then I
second.
think we'll pass it to you.
Yep,
Yeah,
go ahead.
perfect. Awesome. So yes, we need federal policy, right? And Medicare for All is a great step in that direction by including abortion access under free coverage of what's listed as comprehensive reproductive, maternity, and newborn care, and by noting explicitly that the Hyde Amendment restrictions would not apply to the new Medicare for All Trust Fund. Like the Hyde Amendment was passed shortly after Roe v. Wade, saying that federal funds cannot go to abortion access. It's bad. It needs to be gotten rid of, but it will not impact what's happening here. So that's a great thing. So there's going to be more to make sure that abortion is truly accessible, even after we pass Medicare for All. This would be a giant move forward. So I guess I'm here to really encourage you, if you're not already, right, to connect with your local reproductive rights, freedom, and justice organizations in your area. In particular, local abortion funds will know better than anybody else the barriers that people are facing when they're seeking abortion where you live. You may want to connect with Planned Parenthood or other abortion providers or advocates. And I hope that this is a talking point when you do this work because it's so crucially important. So yeah, if you want to learn more about Ultraviolet, what we're doing to protect and expand abortion access, as well as working on other issues of gender-based violence and economic security, you can get a hold of us. The website is www.weareultraviolet.org. And yeah, I hope that we can connect in the future. Thank you so very, very much for the work you're doing.
Thank you. Thank you so much. Let me quickly turn it over to Fran Quigley. Ellie, if you can wait one more minute.
Sure.
Fran Quigley, who is with Faith in Healthcare, based in Indiana. Faith in Healthcare is another one of our partner organizations, talking again as we think about reaching out to various constituencies that can be really powerful in our local advocacy. The faith community is one of those as well. So I wanted to have Fran share some thoughts around that.
Sure. Thank you, Melinda. Wow, it's an amazing lineup, and it's so cool to have so many people from around the country here. Real briefly, Faith in Healthcare, the organization name, hopefully we chose it well. It is what it sounds like, is that it's the We try to lift up the faith community's involvement already on healthcare access. We started as a prescription drug pricing organization, now are a bit broader, as the name suggests. And our main kind of product, what we try to contribute to the cause, is a weekly e-newsletter. We do lift up folks from all different faith traditions who, again, have a huge amount of agreement on access to healthcare being a human right and a moral imperative. So I'll make 3 quick points because I know we got limited time. We've got other folks to speak. But number one is that I would say to all of us who are organizing that faith community support for Medicare for All, in my view, and a lot of other folks, it's a really underutilized resource right now. The faith community, this is an easy conversation. Folks in the Muslim community, Jewish community, Christian community, you name it. There is a broad agreement that this is the right thing to do. Sometimes it's very formally agreed upon. The United Methodist, Presbyterian Church USA, United Church of Christ, Unitarians, Reformed Judaism, et cetera, have all explicitly said for many years now that a single payer system is the way that we need to go. So we all have congregations from those denominations in our communities. And they are already committed at the national and international level to this. And so it's not a heavy lift to have that discussion, to reach out to folks in your communities and who are in the faith community and say, hey, can you be a part of our coalition? And I think we all probably know on this call that the faith community can be a really strong partner in a coalition and bring new folks to the table. I just want to echo what Counselor Cornell said, which is that when we do go out and have these conversations, always we bring up stories. And I think you all on this call know that you bring up stories, you bring up supporters, and then that turns whole congregations into being allies. So that's number one, is I think there's a lot of support in our community from the faith communities that we have not, I think, done enough to pull up. And I do think it's out there. I think, sometimes we've seen that in faith and labor coalitions, but those faith and labor coalitions, sometimes they're worker justice centers, et cetera. Those are real natural Medicare for All allies in our experience too. So that's number one. I think that there's real possibility out there. Number two is just an offer to be of help. Again, our organization, Faith in Healthcare, we speak healthcare. We're an interfaith, speak healthcare, we speak healthcare, we speak faith too. We're an interfaith organization by definition and by membership. So if we can be of support to you when you reach out to folks in your own communities, in the faith community, we'd be happy to do that. Again, our website is faithandhealthcare.org. We frankly have done a pretty good job in a short period of time of interviewing and lifting up folks who are advocates in all the major faith traditions a few times over. So there's hopefully some resources you can use, but also feel free to contact me or others directly in Faith in Healthcare to see how we can be of support to you. And finally, is that in talking with Melinda, we actually here in Indiana, I'm in Indianapolis, Indiana, we face a situation in terms of advocacy that probably a lot of folks do, in that we've got 2 Democrat members of Congress in our state. Both are completely on board with the bill. They're great. They're in the caucus and everything else. The rest are Republicans and are never going to do it, or at least not in the short term. So what do we do as advocates? These local resolutions are really a terrific opportunity for us. We've got a lot of blue dots in our red state, and it was really inspiring to hear Representative Khanna say that actually is something that they can use on the Hill to say, look, the city of South Bend, Indiana, and Lafayette, Indiana, and Bloomington, Indiana, all these places are actually supporting Medicare for All in their city council. Shouldn't we be doing that at the national level? So I just want to endorse that. It's something that we want to work on here in Indiana, and it's exciting to see all the progress that all of you have already made in places like Florida.
Thank you, Fran. And now I'd like to turn it over to Ellie Gomez, who is who's doing great work with a really robust coalition in Maryland, and they have multiple city and county council resolutions underway. And if you could give us a quick update, Ellie, we're nearing the end of our time, but we'd love to hear from Maryland. So since we're moving to the East Coast now, go ahead.
Yeah, I'll try to make it quick. Thanks for the intro. So Ellie Gomez, I'm an emergency physician. I've been doing this for over 20 years. In full disclosure, I'm a Unitarian, but I was formerly a Catholic when I was a child. this morning I spoke at a rally right after Pramila Jayapal spoke on behalf of Medicare for All. I heard several comments that were so intriguing on this call. Interestingly, the AMA representatives and most of the physicians that are in leadership are not actually touching patients on a regular basis or doing the care that people are actually receiving. And so you are not hearing on the regular basis the individuals that are able to speak to this. The supporters of the movement of Medicare for All, which many of us understand is the only way to get equitable care to all our communities, in particular because I've been serving the underserved in inner cities and critical access hospitals my entire career. I know that the people that you end up hearing from are people in leadership that are actually working at odds with what we were meant to do and what we were called to do. So please do not come away from this talk with the impression that the majority of physicians are actually like the representatives from the AMA that were described before, that it's an absolute inconsistency with what the majority of my peers try to do. In fact, when we contract for services to care for patients, we're compelled to be quieted, be threatened that if we advocate for patients, we're going to lose our contract or be fired. Just the same as nurses face the same types of pressures when you're not talking to nurses that are in leadership at a hospital or insurance company. It's exactly the same as when you speak to physicians that actually care for patients. So the other part that I'll say that with regard to, the part that I jumped in on was right before we were talking about abortion rights. And let me tell you that there is a huge disinformation campaign coming from the faith community in the Catholic Church. I grabbed a pamphlet on the way back to the angle by the Capitol where Representative Jayapal was speaking about Medicare for All. We were in support, they were in support of her. We jumped into a local Catholic church, picked up a pamphlet that had this fear mongering that 1.6 million abortions are performed every year on 20-week old infants, and weren't they recognizable? They have this beautiful pamphlet with a very recognizable ultrasound representative of a 20-week fetus. In fact, most of us that are informed about the issue know that 66% of all abortions occur at 8 weeks or less, and that 92% of them occur at 13 weeks or less. So that's something to take with you when you face these types of disinformation campaigns that paint the concept of abortion in a negative light and minimize the issue of a woman's health or a risk to her life, which is not insignificant. All right, well, get back on the issue. In terms of what we've done locally, I got to tell you that I first of all was motivated to do this because I went into medicine like most docs do because I felt a calling to care for people. I didn't go into this to work for shareholders. I didn't go into this to work for billers, coders, administrators, and the like that are the cause of this conflict where we hear some doctors representing one perspective and then never hearing from people like me. Actually, the majority of us that are caring for people are very knowledgeable that this is the only way to do it equitably. So in the local community, what we've done is I have had, decade-long relationships with folks from the city and the county. And we were lucky to elect in the last election cycle a Democratic mayor and a Democratic county executive. That's exactly the opposite of the philosophy that was being put out there by Republican leaders from prior administrations in both cases. We've been engaged with them. We've gotten them on board with the idea that this is the only way to care. They understand it. They're willing to create legislation. One of our local county counselors is a personal friend we reach out to. She is very enthusiastic about creating legislation that's going to be presented in the fall. And so all I can say is, please do not, it's very much like disinformation campaigns on any front. Hospitals And insurance companies have realized that saying the words social determinants of health or using the terms health equity actually puts them in the sphere of advocates. They are not. They are worried about their profit motive and their profit margins. And when I make objections to it, as I even took a segue and got an MBA in order to understand the language that they were using and understand what their motives were for doing what they do, they're availing themselves and enriching themselves on the backs of poor people and needy people and sick people. They bankrupt people with money. So it's really beyond an economic issue, unless you're in the top 1% maybe of the earners and economy of our country. So you know, all I can say is that this is a wonderful forum. I'm glad to have you know, been invited to participate. Please reach out to me if you want to collaborate on anything. And yeah, there's a lot of us that are all in, and I don't want the idea to be perceived as the representatives that you're getting out there that are the big lobbyists with big money are the ones that are actually doing the care.
Mm. Thank you so much. And we're so grateful to have doctors like you as part of this movement. And it's really inspiring the level of organization that's happening throughout Maryland and the coalition building that's happening to create pressure to pass these resolutions. I think is fantastic, and there's a lot to learn. We're getting toward the end of the hour. I want to invite my colleague Brittany Shanahan, who's been talking with a lot of you and activists around the country to share an update of kind of where we are and like what our next steps are. So Brittany. You're still on mute.
There we go. All right. Unmute. Worth the wait. So, hi, everybody. Melinda, would you mind sharing the resolutions map? Because I can't.
Yeah.
So our Medicare for All Resolutions map has grown big time since our last webinar, with new organizing efforts from Idaho to Alabama, the successful resolution in St. Petersburg leading to a new focus on Tampa, and the upcoming Cook County Medicare for All resolution hearing in Chicago. So here's our updated map of communities that are mobilizing for Medicare for All, but I have a feeling that it's not everybody. So it's a good chance to, and we're sharing, Melinda will share the link as well in the chat. So you can look on it and find out, are you on the map? Because we have a variety of folks who are getting involved. If you're not on the map, we can put you on there. What that means is that people will see that and they will get in touch with us, and then you can start building things together. You don't have to feel like you have to lead everything yourself. If you just want to be a part of something, if you want to be part of all these exciting efforts that Ellie and Sheila and Mike have been talking about, then there are a couple of ways that you can sign up. If you see your city or town on the map, you can click on the marker in order to see the link to sign up. If you're already organizing for a resolution and it's not on the map, you can click the link that Melinda just shared in the webinar chat to sign up, or you can just go to the website and click Take Action in Your Town, and then it'll say sign up. Or you can just give me a call or an email. I'll share my information at the end of this. So you can also sign up using this link if we haven't reached your town yet. So that's the link. Melinda, if you could click on it, if you could go to, what is it, something in your town, Take Action in Your Town at the top. And then on the right, sign up to take action. So this is where you can sign up either to get started in your area, or if you're already organizing and you don't see your area listed on the map. We'll connect you to people in your area who are ready to get started or who are already going at it. So please, let me give you my phone number. Please do get in touch if you have any questions at all. If you want to get involved but don't know where to start, Here's my phone number. Let me share my screen. Share screen. There it is. All right, there's my phone number and email address. So, and also you can just find me by looking me up at Public Citizen. And you probably have gotten a bunch of annoying emails from me as well. So please, please, please get in touch. I'd love to talk to you and find out what's going on in your part of the country. And it's always great to see your names on these calls. So thanks.
Great. Thank you so much to all of our panelists. We unfortunately, we're getting to the end of our time, and I really appreciate everyone who's been asking questions in the chat along the way. I know many of our panelists have answered them. We will take a look at them. If some of them weren't answered, we'll do our best to follow up with you. Once again, you know, I feel very inspired after this webinar. I think there's activism happening all around the country, and it's really been bubbling up in short order. I mean, this is a decades-long fight for sure, and many people have been doing this for a long time. And I do feel like there's concentrated energy right now, and we felt it on the Hill today in Washington, D.C., and we heard about it tonight from the West Coast to the Midwest to the Deep South to the East Coast. We're mobilizing here, and it's truly exciting. We'd like these webinars to continue to be useful. So if you're doing organizing and you have specific questions you'd like for us to answer on these webinars or themes, please email us. You can email Brittany and let us know, or call and give us some ideas. Or if you would like to present for a few minutes and tell us about tell activists around the country what you're doing and what you're up to, and give tips. I think we've decided that that's actually even more helpful than just hearing from experts for activists to share each other. So please, please let us know that. Our next, you can mark your calendar now, and we will update the website with the RSVP link for Thursday, July 11th, given that it's the summer. We're going to have it in a few weeks now. So Thursday, July 11th at the same time will be our next webinar. And please don't forget to look at the map and sign up, as Brittany mentioned. So if you're close to one of the efforts underway, or to help us fill out the map. And there are a lot of exciting things that have been happening, amazing work being done, and it's being done not by experts. It's being done by people who care. And we, on the website, we have a comprehensive toolkit that has talking points. It has step-by-step guidance, how to talk to the media, how to talk to your council members, sample resolutions. And so there's a lot already there. And if there's something more you need, contact Brittany, because we will be able to connect you with those resources. So thanks again so much to everyone for joining us. And and a special thanks to all of our panelists who I think just gave a wealth of information this evening. And thanks to all of you for your activism and your commitment. So thank you once again. And we will talk to you next time.